platform.org, and here we are. We are getting started for our Build a Town piece. We'll go through this nice and quick and basically look at how our team of humanitarian specialists have been able to do some great things. There's our logo: your world, your fight, your choice. Let spirit destroy greed. Very cool. And let's get going. So this is our, so what we are. We're a combination of specialists, always said, from medicine, engineering, security, public policy, economy, blah, blah, blah. And basically, this is looking at best practices from ground up, sometimes top down strategies, but often bottom up, because we have what we call a Build a Town organizer. The Build a Town organizer is going to be who we're focusing on today. So this is for you guys, the people that are taking on this entire program locally, organizing all your local working professionals and community leaders. There are different goals for different areas where we work. I've worked across Africa, Latin America. We have people out of the Middle East. We go to Asia. We have everywhere we've been to. There are some things we say different but the same but different. So there are unique issues that are plaguing each individual city or region or territory, but some things are just global problems that unfortunately keep recurring, and they are the things you would imagine. So human trafficking, child sex trafficking, that's across every major continent still that we've worked, and that's unfortunately a reality. That's a top priority. The drug epidemics, both on the supply and the demand side, that's a top priority. Looking at, in some places we've worked, organ harvesting, not so much in many areas, but in some. Rape and abuse of women, unfortunately, is a time-old human rights crisis that has not gotten better in a lot of the places we worked, from parts of Latin America, East Africa, Southeast Asia. It's stuff that must be dealt with. Stonings, public stonings, all that silliness. Punishment by death. So, we get into that about for death penalty stuff. I would just say a caveat to that, as many countries have death penalty. This is things that the vast majority of the world, this is not punishment by death for a guy who goes into a school or a shopping mall and shoots 100 people. Now, even then, some people will contest death penalty for that, but that's not what we're referring to. We're talking punishment by death for what we're talking medieval standards, in places where, if, say, a wife cheats on her husband, and in that area they still try to enforce a punishment by death type thing, which is insane. So there's some common sense that has to go into that. Maternal mortality rates, yes. And that, just so you know, is it's a leading cause of death in young women in many countries. But maternal mortality and infant mortality rates, I should just note, that's like a really good reflection of how the state of the health of a nation. Look at how many of their pregnant women die and how many of their newborn babies die, just as a side note. So those are some examples. That's not a cumulative list, by the way. That's not a total list. That's just some examples of some obviously very important things we focus on. So how are we best handled? So you have, in most areas, there's the paradigm of the federal level, the country, national level, then the state or regional district level, and then the local town or city or village level, depending on where we go. And so this is just, it really is up to the local leaders to do this and to use this stuff. And certainly you should know better than to wait for any foreign military intervention to fix your country problems. Hopefully you're smart enough to know that. Hopefully you're smart enough to not, wait for the United Nations or even largely rely on United Nations. Hopefully you're smart enough to not rely on big international NGOs and all the missionary teams. I'm not saying these people all in these different groups have great hearts. I've worked with a lot of them, but the gaps in the strategies and limitations and bureaucracy, and they're just, So let's go ahead and let's go ahead. So sorry, we have some screaming playing kids in the background, so sorry about that. Here we go. How to use this protocol. All local leaders should start here, right? Because this is going to set the framework for the whole thing. So if you are a local leader in your area, you likely don't have access to a lot of money or power, but that's okay. Because what you are going to do is in just 3 to 4 hours a week, you can go through an entire protocol systematically. You don't even need to be the water engineer. You don't need to be the doctor or the nurse. You don't need to be in charge of security operations or the local police chief or a youth worker. You don't need to be any specific niche, any specific area. What you need to do is just be organized with your time and organized with your outreach, following the protocol, and really have the willpower, right? What I call God's work, not to bring we don't bring religion into our work, but we do bring spirituality. And you should know you're doing a higher calling for whatever you believe. There's some higher purpose to what you're doing with this Build a Town. I really mean it. Yeah. So we're going to go ahead and talk about the results section, and we're going to talk about what it means in our terminology when we say build a town, that you are working on your own local village, town, or neighborhood section of your city, and you're building it up. So you are at the top. You are the Build a Town local leader, what I call the organizers of the Build a Town program and protocol. So you are the organizer. You don't need to be a super specialist. You don't even need to be a neighborhood leader, having a bunch of families following you or knowing about you or you being of influence. You just need to be very clever with your time and smart with the protocol and just be regimented in carrying out this work. And you are really, the organizer is the connector. They are the great connector of each local town or village group or small city area. You are the connector of all the important practices and protocols, reaching out to all the local leaders. So now, who are the two main groups you reach out to? Let's go through them. You have your professional local leaders. The word professional should ring, of the specialists. Those are your own, and again, you're not working with expatriates. My dear God, let me emphasize, these are your own local people of your own flesh and bone, of your own local area. Now, if it's somebody who is not temporarily living there, if there's a guy or girl from, Canada or United States or Italy, and they're living in your area for life, and they happen to be a water sanitation engineer, then by all means include them if they're really there for life. But a lot of the time, there's this transient group of people for living somewhere for a year, and going back and forth, and they're not what I would call a permanent long-term member of the community. When I say professional local leaders, they don't necessarily need to be your own nationality or regional, local ethnicity or whatever. They need to be somebody who's just a good, smart human being person who is living there long term, the next 5 to 10 plus years. That's who we're talking about. And obviously they need a professional area, and we'll go through that. Okay. And you're going to reach out to these professional local leaders, and you're going to be checking on their efficiency, because that's a huge thing that doesn't get done. We assume that specialists, and professionals of a poor developing area are most efficient already, but that's not true. That's a false assumption. It's not that they're not hard workers. It's that there's better, smarter things they can be taking on and doing. So that's number one. And number two, you're going to go ahead and do follow-up to go ahead and see that what they're doing is tying into the bigger picture for Build a Town, that it's having effective change. So you can't talk about, let me give an example. If you're in the hills of say, Colombia, you can talk about building, water sanitation fences where all the animals are sharing the regional, the local water supply with children getting water in mountainous areas. And of course, they're all getting diarrhea and they're getting sick, and some of them are dying because they're getting, animal-driven diseases from local animals sharing the local water hole, which is not sanitary. It's not healthy. It's not a good idea. But that might be the only area of water they got because it's up high in the mountains. You could not talk to your professional local leader and say, hey, man, we're going to do this fence. We're going to get, for just, small money, like $1,000 US, we can build a nice, easy fence. And you fundraise with the diaspora, or you even use local material. You get some guys involved, some guys and girls, and you just build your fence. Okay. You can't check that box and say, we made a water sanitation improvement, and in the Build a Town protocol is kind of a pain in the ass in that it pushes you to say, wait a minute, we got to check now over the next 6 to 12 months how many little kids are getting diarrhea, waterborne diarrhea-driven diseases, dehydration, in some cases, unfortunately, even dying for infants and little toddlers. How much is that still going on in that mountainous village region of Colombia and Latin America? How much is it still going on? If it's still going on identical in numbers, then it's great that you built a little fence to keep out some of the local animal wildlife. But at the same time, something's not clicking, something's not working. You didn't get your goal. So that's still, the kids are getting the same amount of waterborne diarrhea diseases where they're still getting dehydrated, ending up in hospital or clinic, or in some cases, severe cases, even dying. And that sucks because you got to make that change. So I just want to note that. That's important. For our neighborhood-specific leaders, so we're on the other side now. This group, you're going to go ahead and you are going to see that these are families or men or women who have been there for a while and have pretty good influence of their local area. They may or may not be in local politics or government. They may or may not be. That's secondary. What matters is they have a voice of influence. They are a known person, and that's fine. It could be a spiritual local leader. It could be somebody who's looking at just, mom or dad who's been there forever and their family is kind of well known and friends with everybody. They have some degree of local influence in this, and they are in the streets they live in, and they are able to reach families for what we call community discussions. And those are your neighborhood specific leaders. Those neighborhood specific leaders may or may not be a professional local leader. For example, we have had small little city sections in India where it was a local medical family where, the mom was a nurse, the father was a doctor, and they were very well known and respected in their Indian community, and they had a lot of voice. That's a family, that's an example that by trade, being doctor and nurse, they are on the left side professional local leaders. They're in the profession of medicine or healthcare or nursing, but they are neighborhood specific leaders because they kind of host all the local parties or the gatherings and they are well known and they have a lot of voice and influence. So they are also on the right side neighborhood specific leaders. So while we separate these two groups, they obviously could be the same family or the same man or woman. That is possible, just to be clear. Okay, moving on. Let's see. Okay, we went through some. Back to the left side, remember, professional, the right side, neighborhood-specific leaders. So for the professional on the left side, we go through real quick: engineers, doctors, nurses, water sanitation, teachers, local government workers, tribe leaders, women rights leaders, farmers, agricultural workers. Could be your local legal counsel, attorneys, lawyers, police. Okay. And when we talk about universities, a lot of people worry about that. Don't worry if there's not a nearby university or hospital. You would just include the next nearest one, even if it's a couple hours away, because we do work in some remote rural areas, obviously. Neighborhood-specific leaders on the right side, so to the right now. That is a neighborhood-specific leader that we would like to get the most bang for our buck, the best influence we can get for the most families. We put in our protocol up to 30 families. 40 sounds too much, but 30, that's probably a push. Maybe even if you could get 20 families. If there's in your village area, in your town, if there's 20 families, that could be listened to and organized by one neighborhood specific leader, somebody who's very much about the community, regardless of their working job title. Just they're very prominent in the community. If they could get 20 families to listen to them or be, organized under them for some of the discussion, community discussion, that would be amazing. We put 30 to 40. I think that's maybe wishful thinking. But obviously, you don't want one community leader to 2 families or 3 families, because that's not enough, because then you'll have to find a ton of neighborhood specific leaders. So you want to try to have the most influence they're willing to outreach for the most families along their group of streets or their area. Also, very important, yes, we have a long-term project of many volunteers in many countries working hard to translate all our stuff from English. I speak English. I speak other languages, but all our stuff is written in English. None of it is yet translated. Your neighborhood specific leaders, and while we're at it, your professional local leaders, professional workers, they must be able to speak English. That's a hard yes. Okay, that's important. The professional leaders, I suppose, if they didn't speak English, but you were going to go ahead and explain some of the protocols to them and translate it in your own language, that would be extra work. But honestly, in my experience, most of my time working with folks out of Asia, Africa, Middle East, Latin America, a lot of working local professionals speak some English. But again, not all. And so that's just something to think about. Somebody would have to help translate for them to know our protocol, obviously. But for sure, on the right side, your neighborhood specific leaders, they must speak English. It won't work if they don't currently. Okay, read and speak. Sorry, read and speak English. Okay. Here we go. So the quick strategy to get local leaders, because you say, well, here I am. I'm the organizer, director of the Build a Town. I got to find both groups. On the left side, the professional local leaders, and on the right side, the community neighborhood specific leaders. So what are we going to do? I would say the easiest thing is just word of mouth. Start talking to people in your community. Chances are you've lived in that specific group of villages or town or neighborhood, city area, that you've been there for a while. So it's not hard for you to find these people. But if for some reason it is, thank God the internet's in most of the world now, and we can use it for good. And you can create a social media account. We put anonymous. That's if you are in a risky, I should say, take a quick minute to say, we have people in parts of the world that are rough and violent and dangerous, that they do our work, but they do it anonymously. Of course, we will, to be on the books, we're telling everybody officially, follow your own country's rules, laws, regulations. But yeah, they do it creating an anonymous account, and they do that to protect their own identity. And in some very violent areas, hopefully you're not in one of those very violent areas. But if you are, that's one option you have. And either way, you can put out in that social media account, you can actually do like a little free marketing advertising by putting out some free information, a local valuable piece of information. Like we said, a local natural remedy or something, or an herb that you can use. Excuse me, I'm yawning. It's been a long day. And then we would do, you would give a call to action, and you would just say in that post on Twitter or Facebook or whatever, you would say, giving this email or an anonymous email you create, you would say, reach out to me if you want to be part of massive change. Or if you're comfortable, you can give your phone number too. And you can do a social media post. So you can say, calling all local doctors, calling all local nurses. Hey, I need to talk to all local farmers. Hey, I need anybody who, this neighborhood, whatever you want to call it, the south side center of, of your city, and say any, south side families that want to go ahead and do some good and do God's work and help out, and give some great, information and some community work done for your community, and see who comes to you. So you could advertise through your own social media account. But most often, 90% of the time, our community organizers, you, who I'm speaking to, you are doing this just through word of mouth, because you probably know your community already. You probably could tell me in 1 minute who the most influential community guys and girls are and families, and who all the local working professionals are if you've been there your whole life. Okay. Timeline for Build a Town. Week 1, spirituality and money, service, resources. Sorry, a little congested here. We have spirituality and money service resources. This is important. Why is this important? Well, two reasons. It sounds weird to have spirituality and money on the same page, but it really is. And I'll tell you why. You don't want to be greedy about money, but groups, hospitals, clinics, your local engineers, the resources they need, your local youth workers or teachers, professors, things they need for their schools. They need money and resources to do the physical work they're doing, right? Even if you want to call it God's work, but you need that. You need those resources. You cannot tell a teacher to go do God's work and teach little girls and boys to read and write and arithmetic and give them like no books and no paper. That's silly. That's idiotic. So there are money and service resources are important. And it's not to be a greed factor. It's to be a utility factor to get done what you need to get done. And a lot of these places don't even have that we work. So this is an important section for them. Also, spirituality. You should not, any person you work with should have a spiritual component to them. If they are highly greedy and highly materialistic, I would avoid them for our whole program. Okay? There's that. People should be spiritual, and we want them to be spiritual, and we help them become spiritual. And a quick plug. Spirituality is not religion. Let me repeat. Spirituality is not religion. You can be extremely religious. It does not prove to me you are a spiritual person at all. Okay, good to know. Okay, so spirituality. So number one. So we can talk different spiritual practices. We have a spiritual section we go through. We have actual different little moving meditations, breath works or pranayamas we call, doing different things like Tai Chi, like spiritual practices that people can do. It doesn't matter if it goes across culture. I'll tell one quick little story. I know I got to keep moving, but there was a group I worked with in East Africa with some of my Somali and Kenyan and Ethiopian brothers and sisters, and they were doing amazing work. And I said to a couple folks here in North America, including some of the diaspora, and I'm not saying all diaspora would say this, but the group out of this particular group, I said that I was thinking of doing some Tai Chi and some of what would be more like Chinese meditations, and they said, no, don't waste your time. You are going to just upset them. It's not from their culture. And I said, okay, because I'm like, it's a little weird because the world is big and diverse now, and we share things, and it's like I like to eat food from other continents and places that have nothing to do with me or my history. And so that sounded a little weird, but I'm like, okay. So I was thinking like, no, I'll just, because I teach martial art and, I teach some meditation stuff. And I'm like, all right, I'll do my own thing. Well, wouldn't you know, outside the hotel we were teaching out of in that little town area, some of them saw me doing what I was doing. And would you guess that all these local leaders, including even like farmers and like engineers and everybody, that morning they said, what are you doing? And I said, well, I teach martial art and I do some Tai Chi and stuff. And, I was going to include it in the actual workshop in the days, but, I figured that it was just, it's not obviously Tai Chi does not come from East Africa. So it didn't make sense. And so I, kind of left it out. And they said, no, show us. And every morning for the rest of that week, like clockwork, every local leader, every community leader, every working local professional got their butts out of bed like an hour before the seminar and did all my meditation and Tai Chi stuff with me. And that's how we knew we needed to include the spirituality component, because it didn't matter what the religions were. Spiritual practice and meditation is spiritual practice and meditation. So that's a quick side note on that. So everyone who thought it wouldn't work, eat your heart out. All right, next. Number 2, money and food. Money and service resources. Okay, so we have here, if you're running a business or a nonprofit, domestic, local NGO, again, not foreign, no working with foreign groups, local NGOs, domestic NGOs, local foundations and charities, that you can go ahead and focus this section on them, although you can share this section with all your local professional groups from, your local hospital, your local clinic, because they probably could use some fundraising or money resources. They always are needing resources. But we have a whole money and service resource section, and you can go ahead and you can give that to them. And you should also have one person on your team exclusively, that you discuss with them. One person from the clinic, one person from the local church or religious building, whatever it is. They should be focused on that for their own area. Because that's a comprehensive little piece we have. So, because you alone as the organizer cannot be required to help explain and go through that part of our protocol for each local business you have and for each local municipal building, or you can't do that. That's too much. That needs to come from them, from their group. So again, for example, your local hospital or clinic, it's their own worker out of the local hospital or clinic. Or if it's a local NGO or nonprofit working with kids or orphans, it's their local orphan workers who are going to get to focus and take that money and service resources. That is not for you to take on for all of the local groups and people in your community, to be clear. But you are sharing it with them, explaining it to them. All right, so as we go through this, we're on week 1, right? So that's the spirituality and money service resources. Okay. For your neighborhood specific leaders, you are going to go ahead and you're going to see how many local neighborhood specific leaders you could get. Shanghai and China, yeah, you would need, that's probably wishful thinking, only 40 to 50 local leaders. Oh, I'm sorry, for that one city section. Okay, not for all of Shanghai. I was going to say that's ridiculous. For that one small city neighborhood, sure. And even that may not be enough. That's a very populated area. But you'll have to just tease it out and do. We have a saying with the neighborhood specific community leaders, for neighborhood specific leaders, the more the better, the more the merrier. So just try to get as many as you can. And then you'll put down their names and you will fill out a sheet called neighborhood specific leaders. And then after you fill it out, you will go ahead and you will, email each of them, or you can cut and paste our form email. We have an email in there, and you just take one afternoon, you cut and paste to email all of them. And they also can help you. Your neighborhood specific leaders can be tasked, and you can ask them to help find other neighborhood specific leaders. So it's not all just on you. Here's our little thing. I need your help now. We are going to rebuild and improve our local area, but I cannot do it alone. Will you help me just one day every few weeks? Go to communicationplatform.org and click on Community Leader Free Resources. And this is, you're going to go ahead and just find as many as you can. And you're going to give the name, the street. I find it's helpful to put the street and the phone and email. So that's all week 1. You did all that week 1. Let's keep going to week 2. Community leader meetings. Here we go. This is a very important, intelligent way to gather all the local leaders of your area. Again, your town, your group of villages, your neighborhood out of your city. Maybe not the whole city if it's a big city, but just your neighborhood area. And you're gathering these local leaders for community leader meetings, which is a free capacity building community group that you help organize and host usually once a month. And we have a whole thing on, you can go right on the Build a Town link. It's free for everyone to download. Just go on the website, click on big letters, Build a Town, and you can go ahead and direct them to the sections listed there that you will update them. And it's called Community Leader Meetings and Spirituality and Money and Service Resources. And that's what you're doing. You're just having them, all those local leaders, you can have them go to the website, click on Build a Town, and you are going to have them click on the or look on under the table of contents, the community leader meetings. And they also should be directed to read about the spirituality and money and service resources, as that will likely help them and pique their interest. Okay, so that's what you're doing for week 2, community leader meetings. Getting all your local leaders and you're going to find a building and find a time and place once a month, maybe every Wednesday night from 7 to 8 p.m., for example. And you will do that and get all of them to go to the website and do that. I'm repeating stuff because it sounds like a lot, but I want you to know that this is doable in weekly pieces, okay? And they'll go to the big PDF, which is like a couple hundred pages. You don't have to be overwhelmed. They don't have to be overwhelmed. You'll go right to the section called Community Leader Meetings and Spirituality and Money and Service Resources. And that's kind of their reading material. And you have them come every month. Next, week 3. So look at what you've already done, and you're only on week 3. Medical health care. Can't forget about it wherever you work. So you're reading this. This is obviously your outreach time to professional leaders now. So remember in the last one, you went to work with, you reached out to your neighborhood-specific leaders. Remember? That was in week 1. And all your community leader meetings, which is kind of everybody, for week 2. Now we're on week 3 doing your professional medical healthcare leaders. So your top local nurses and your top doctors and hospital directors. Very important, if there's not an OBGYN clinic or nurse midwife in the area, you must find some local woman. And I mean, in most cultures, it's just going to end up being a woman, and that's fine. And you're going to create an OB advisor position. You really are. You're going to take local healthcare into your own hands. As always, follow your own local rules and regulations and laws and all that stuff for your area. But you need to find a local OB advisor to help, because we don't want young women dying or babies dying in pregnancy. It's not fair. It's not right. A lot of that can be prevented. So do God's work. Take it upon yourself to do it. So you're going to find an OB advisor that if there is not already a local delivery place. If you're in an area where it's the grandmother who's delivering babies in the bedroom, you find a local OB advisor in your area. Got it? Next, reach out to local leaders, nurses, public health workers, and directors of hospitals and clinics. Yes. You'll need 10 to 20 minutes to speak with them and discuss, about the best practices and protocols in the medical healthcare section. Now, a lot of you organizers out there, you say, listen, man, my education is I graduated secondary school. And I didn't even go to local university or college. Doesn't matter. Doesn't matter. As long as you know how to read and write and speak. And English in this case, because we're communicating in English to do the program. And in your local tongue, your local language. As long as you can read, write, and speak in your local language and in English, you are smart enough to do all of the Build a Town protocol. I swear to God. You can do it. I've had people who did not, in East Africa, I've worked with community leaders, did not finish secondary school, but they could, speak, pretty good English to me. They could read, they could write, and that was it. And they did the whole thing over several months, over a year. They made amazing change. You can do it. And so you don't need to be a nurse or doctor to do the healthcare section, because you're going to just give this best practices to them. Okay. And you're going to go ahead and give them better, smarter ideas and smarter strategies and protocols for their area. Even though you don't have the knowledge of a nurse or doctor, does not matter. Get it? Makes sense? So you're going to reach out to 10 local individual public health workers, physicians, nurses, blah, blah, blah. Yes, we did that. And we've explained that, I think, well enough. And you're going to email them the document. See the pattern? You're going to have them go to communicationplatform.org. You're going to have them click on Build a Town, and you're going to tell them to read in the table of contents, the sections, medical healthcare, spirituality, money and service resources, because their clinic or hospital is always needing more resources. So that will be important for them. Also, mandatory handouts for all local leaders to help with. We'll get to that section, but that's very important, especially for anybody who works with young people, which healthcare people do. And public policy. Good. Look at how much amazing change in God's work you're doing in just 3 weeks. Now we're on week 4. Let's keep going. It really is insane what we built and insane what we do. Sometimes I just can't even explain to American college professors who have studied an area all their life and what we do, what I do. It takes them like a whole minute to process it in their brain, because it's just so insane what we do, but we do it. Week 4, nonprofits and spiritual leaders, and women's and children's rights. So these are the groups you're working out to of your own local area, no foreign groups. Local nonprofits and local foundations, local charities, local NGOs. Got it? Local spiritual leaders and women and children's rights. Anybody who, usually those groups go closely together. Anybody who runs local women's rights, children's rights, or women and children protection groups. Okay. You're reaching out to these folks, and these are going to be considered professional leaders, and they are, we're going to divide it into two groups. We're going to say the women's rights and children's groups, and then the spiritual religious leaders of your area. And you will have them go to communicationplatform.org, click on Build a Town, the big button, have them go download it for free. Tell them to read in the table of contents section. They will go to the pages of nonprofits and religious spiritual leaders. They will go to the pages of women and children's rights, spirituality, money and service resources, mandatory handouts for all local leaders to help with, and public policy. Do you see a pattern here? I probably don't even have to go through the rest of this PowerPoint, but don't X out of this presentation. You keep listening because we're going to keep moving here. So week 5, governance, economy and governance. Okay. So all you're doing is finding the right players in your local area, and you're going to make them smarter in smarter ways. That's all you're doing on the professional leader side. Like, you're just going to help them do better, smarter things out of their own area of work. And this is the beautiful thing about it. And you're going to get them to think about things that they might not be thinking about. Imagine there's a woman that we worked with in Somalia who wanted to do great things for the women, because women's rights are horrible in parts of where we've worked in Somalia. And she just wants better, safer life for women there, especially young women. And oh my God, she didn't know any of the stuff about public policy because nobody had ever showed her or helped her. We went through this. This woman now feels so empowered to speak and to know who to speak to, even if it's in an area that's dangerous, that she don't feel comfortable to speak, but she knows who to speak with and what to speak about and how to speak about it from our public policy section right here. Public policy, see, public policy section. That's amazing. That's beautiful. That's God's work. All right. Week 5, economy and governance. Let's go. Find the local leaders, people who run big businesses, find people who are in charge of local government. We got a big question. Areas we've worked, like, for example, parts of India. Yeah, they say, we don't know how to include some of these business leaders because they are extremely corrupt. That's what my local organizers tell me. They say, Ryan, they are extremely corrupt. What do I do? I say, well, when you do in week 5 economy and governance, when you outreach to week 5 and you have to find local business folks in your area, try to just not include the ones that are really corrupt. Now, if they are all corrupt, that's a bigger problem, but hopefully you can find a couple that are reasonable, that are not very much cheating, and that you can just find the ones that are not corrupt. And same with local government. Of course, lots of your local leaders in government are going to be corrupt. Of course they are. You find corruption anywhere. Find corruption any part of the continent, anywhere. But you need to go ahead and reach out to them, and you need to find at least the ones that are, I mean, in the worst cases where corruption is everywhere, reach out to the ones that are the least corrupt. That's what I would say. Because again, we work in some crazy areas. So you want to push transparency, yes, and include legal workers of local public policy and environmental lawyers and specialists. Reach out to 10 or more, and go ahead and, again, it could be a local economist, could be somebody who's working out of economics out of your local university, could be criminal justice workers, local lawyers working in criminal justice, environmental law, government workers, even up to the mayors, local mayors. And again, what will you do? Click on Build a Town link. Have them go to the website, click on Build a Town link and read those sections out of the table of contents to go to those pages of economy, governance, spirituality, money and service resources, mandatory handouts, and public policy. Okay? Week 6, education. Got to do education, especially early childhood education. It's the most important. These are your professional leaders for education, including early childhood education, Let's go ahead and let's reach out to policy workers, local ministry, primary and secondary schools, 10 university directors, depending on how many universities are in your area, and anyone who works on public policy education. And you can go ahead and have them go to communication platform, and again, you'll direct them to those areas of education, spirituality, and blah blah blah, all those different sections in the protocol. Well, I'm drinking some coffee here to stay awake. All right. For those of you who aren't aware, I also work in healthcare and do some medical provider kind of work, and that's one of my many hats I wear. So it's been a long day here, so bear with me. All right, week 7, media. Yeah, media is important, and corruption, the same thing. Corruption sucks with the media. In a lot of areas we work, Africa, Asia, Latin America, the corruption sucks. And you want to try to find those in the media that are the most God-loving, God-fearing people. Again, not to bring, it's not bringing religion into it, it's bringing spirituality into it. And you have to believe in something really greater than yourself to be doing this kind of work. Even if it's, even if somebody said it's more humanity and, than God they believe in, it's got to be something, a higher thing you believe in. It's got to be some higher spiritual ground you believe in, because this is just, it's important work, it's hard work. And so you want to find those that are going to be the most useful to you. And in the media, people that you believe, hopefully you follow your local media, and hopefully which ones are corrupt or which ones are biased. But you want to reach out to them, internet, television, radio, and you want to go ahead and you want to, again, have them go, you'll outreach to them, and you will email them this document. By the way, yeah, you could email. I didn't think of that. You could, all of these things for my community organizers, you could just download the Build a Town document, which is like 200 or 300 pages. It's like a big PDF file. You could download the PDF file and you could just email it as an attachment, depending on internet access for everybody. But if for some reason they don't, in a lot of places we work, even the local doctors and nurses, because it's so remote sometimes and rural, they are going to like the nearest cyber cafe, what we call like cyber cafe, internet cafe, and they're having to go and get our stuff there and print it out there. That may be the case. Hopefully you're in an area where the internet is good enough. They don't have to do that. But in worst cases, have them go to those areas. Or in the worst case, if it's just you with access, obviously you have access to internet yourself to be doing this protocol and to be the community organizer and to be listening to this online. But you can go ahead and you can print out some of these pages and make local copies and hand it to, again, all your local working professionals. In the worst case, hopefully it's not that dire a situation and they have email and internet. But you'll go ahead and you'll email them the section. I mean, you'll tell them in the email, go to communication platform, click on the Build a Town link, and you will direct them under the table of contents to go to the pages of media, spirituality, money, service, resources, mandatory handouts for all local leaders to help with, and public policy. Do you notice a theme? You are trying to get all your local community leaders, all your local professional leaders to learn about public policy. Because so many professional leaders have no idea the groundwork of how public policy can and should work. It's so important. Water sanitation. All right. Sorry, I'm a little congested here. Week 8, water sanitation. This might be the most important week out of the whole thing, aside from spirituality. I want everyone to have spirituality, but you got to have clean water or just everyone's dead. So professional leaders, here we go. Find your local professional leaders in charge of clean water processing. Have them go, direct them, again, email them, Build a Town link, and go read those sections, listed in the table of contents. Week 9, food and agriculture. Find your local farmers, agricultural workers, and find at least 10 or more. We say 10 or more, but can I tell you, if you can find 30, in your area, God bless you. That's great. Find more the merrier. but at least 10. And then have them go to the website, click on the link, and then, go to those sections. Every person has their own section, food and agriculture, but then we all cross-train them, spirituality, how to get money, service, resources, mandatory handouts, and public policy. Week 10, engineering. Love my engineers. I'm way too dumb to be an engineer myself, but actually all the other men in my extended family are in some form or not engineers. And I just teach karate. So there you go. Okay. Karate and Kung Fu. So I am skilled. Okay, here we go. Professional leaders. Are you ready? Find them, 10 or more at least. If you're having a hard time finding them, start with your local university. They know where engineers are hanging out and working. Go to thecommunicationplatform.org. Tell them in the email. Click on the Build-A-Town or attach it to them in the email. If you download our PDF file yourself, have them go to those sections in the table of contents, go to those pages and read and get going. Week 11, community leader meetings. Okay. So, and I just want to clarify, from week 11 to community leader meetings, this was when you started it. Okay. And week 11 now is when you, now you have been doing 10 weeks, hopefully, if they started it right away, of community leader meetings. Let us know how they're going. This is not a typo. We did not screw up. We did not mess up putting community leader meetings for a separate week on week 11. Understand, 10 weeks has gone by. You now need to check in on your community leader meetings. All those local folks involved, from your local military commander, and if there's military based in your area, of your own military, of your own police chief, of your own mayor, of your own head of your secondary and primary schools, of your director of your local university, the directors of your local clinic or hospital. All these local professional leaders and community leaders, you need to see, how are those meetings going? How's it going, man? What's happening? You need to see what changes have been made. Let us know. opensources123@gmail.com. What are the problems coming up in the meetings? Is everybody just arguing? Because there's often people in rough areas from different religions, tribes, family clans, ethnicities, just different cultures. Sometimes they get along, sometimes they don't. How are those monthly meetings going? Is any progress getting done? Is anything good happening? Hard measures. First of all, is the meeting even happening? For the love of God, I hope it is by now. It's been 10 weeks since you introduced it. And that's just the hard measure is for us. Do the community leader meetings, are they happening? Right. That's the hard measure. They better at least be happening. Week 12, medical health care. Now we're going through again the progress, right? So all this half now is going to be progress. What's happening? What's their progress? You can recognize their hard work. Go on Facebook, Twitter, and social media platforms. See what they're doing. Unless it's like private work, like in this, I would just say for week 11, the community leaders, if your police chief is working on something that's top secret, private, or classified, don't go talk about that on Facebook or Twitter or social media. That would be stupid. Don't do that. But if it's just stuff that's okay for the public to know about, like, I don't know, for the medical health care, if your hospital has a new cancer center or a new cancer specialist, a doctor comfortable working in cancer and IV transfusion meds to take care of local cancer patients, that's a great thing to tell the community, man. That's great. That's wonderful. All right. So good. So go ahead and, make, on your social media platform, say, hey, good job to our local clinic or our local hospital. They got a new cancer doctor, a new oncologist. Wonderful, for how wonderful and lovely and beautiful for our community. Give them some credit. Give them some recognition. Hard measures. This is overly intense, but in your area, has there been a 50% decrease in the last 3 months of measured mortality? So death of diarrhea or vomit-based illnesses of everyone. That's like a very hefty goal to cut that in half after 10 weeks. But I mean, you've done water sanitation work, you've done public health work. They've gone through their own protocols in our Build a Town protocol, doing better, smarter practices. There should be some decrease in death, local death of what I would call dehydration death, especially in either arid desert-like regions or very regions where there's just tough water access, places where dehydration is a real risk of death. There should be some measurable progress, impact, positive outcome. If not, reach out to the local leaders of that. Reach out to your local leaders, and for again medical health care, reach out to your local leaders. Follow the protocol again and identify weaknesses. Is there a 50%? This is a very hopeful goal, but is there a 50% decrease? So did you cut it in half in the last for a 12-month mortality? That's a little bit soon because you're only like 10 weeks in. But is there any downward trend in the death of local pregnant women? If not, reach out to your local healthcare providers again. Tell them what did they not get out of the protocol, what's not working in the protocol, identify weaknesses. Because again, you can change. I have to just say for this stuff, people are like, yeah, but if they're just following words on a page, how are less people dying? Because there's better, smarter practices. That's a whole point of Build a Town. You don't always need a fancy hospital clinic. In fact, let me just go off on a quick tangent. You could be in like the United States, and that's a first world country, industrialized, developed. Yes, there's poverty in the US, but compared to places where we've worked, it's like Disneyland everywhere. So you could have a real hospital and a real birthing center with real doctors and nurses in the United States that even with all our technology and our fancy clinics or hospitals, do you know that we still have a higher mortality rate for infants and for pregnant women than in some developing regions that I've worked in, poor developing parts of Asia, Africa, or Latin America? And you might say, well, oh God, how is that possible? Well, the reason is because they've made community level, community-based changes for, obviously, this program's at this point, you're only in what are we in, like week 12. So obviously by the time you have started this, you're only at week 12. So a pregnant woman could not have carried out 36 weeks or 38 weeks or whatever. But the point is, you can make measurable change without the fancy clinics and hospitals. That's what I'm trying to say. And you can have less, and there are less women and babies dying in poor countries, even some poor, violent areas I've worked, that have better numbers than the United States. And now people might say, well, those areas probably aren't measuring well all that, but those are out of some city regions that they have the measuring going on. They are measuring, keeping track of which pregnant girls die and which babies die. They are in the city regions. They do have they have record keeping. They are keeping track. So I wouldn't say that it's not that they're not capturing it. We have better outcomes in some poor areas that have adopted smarter practices, even with less physical resources. So don't discard this whole thing you're doing because you're not Build a Town does not magically get people more money and material resource, although we do have a section on that for how they can work on that. But it's about doing better, smarter things and using your time and strategy better and smarter. And you don't always have to have like a rich area or a very material area to do those things. So I had to say that. Hopefully that people understand that. Week 13, progress for your nonprofit, spiritual leaders, women and children rights groups. What is their progress? Again, any good outcomes they've had, any initiatives they've taken, give them some recognition. Facebook, Twitter, social media. That's a nice thing to do. And what challenges are they having? And you always will tell them to email us in the results box, because they are filling out in their own section. There is a results box when you go to the nonprofit and spiritual leader section of our Build a Town protocol. On the last page of their chapter in our protocol, of their chapter, the last page of their chapter has like a box, like an actual box on the page that says like, tell us your results you're having or you want to have, and email us. And they email us opensources123@gmail.com, so we can keep improving stuff on our end. Hard measure. If there is female genital mutilation, I know this doesn't apply to most of the world, but if there is, there damn well better be a decrease in that. If there is, linking women to the women's diaspora, which is, if you don't know, diaspora is the people of your area living outside of your country. So for Kenyans, it's like the Kenyans in Britain, the Kenyans in Canada, the Kenyans in the United States, the diaspora of them living in other parts of the world. You have to link. That's a very important measure. That's a key indicator for long-term success of women in a local area, is being well linked and communicated to their own diaspora. For your area, 50% decrease in teen pregnancy in the first 6 months. Again, I know we're not 6 months out yet. We're only on week 13, but that's just something they're working on, right? To decrease teenage pregnancy. And so that's something they're starting to measure, and they should be measuring. Birth control, important. 20% decrease in maternal deaths. Again, you're too soon in this protocol, but that's what they're working towards. Week 14, economy and governance. And I'm not going to go through this. You understand. Give credit to any farmers. Do some fun posts of new crops they're growing or whatever. Give them some recognition. And then go through looking at, have there been 2 to 3 new small businesses that have opened up in your area? Has there been an increase in, for housing or land titles? Housing and land titles and land reform is a very hot topic, firestorm topic area that we deal with. And it's a topic we deal with that's very difficult, but needs to be worked on for people. Has there been a decrease in homicides? That's for economy and governance. That comes from governance, right? Governance. Because remember, there's 2 different things we're talking about here in week 14. Economy, business development, local, regional business development in your area, and governance. And so there should be better policing. There should be less street violence if the local police are using our stuff. Week 15, education. Okay, hard measure for that. So again, education, teachers, do some shout outs, social media, give people credit where credit is due, that they're working on the Build a Town protocol, doing God's work, all that. And now hard measure. Is there a 20% increase in local, young girls in schools with appropriate student to teacher ratios? That's a tall order because a lot of places don't have enough teachers, but that's what you're working towards, right? Through our protocol. Week 16, the media. So I think you understand a pattern here, right? You're checking everybody's progress now. Keep going, and yes, give shout outs, social media. Then go ahead and per news organization over the last 3 months, is there one large news story representing the point of view entirely from the minority group's point of view? That's to make sure that we don't get so in some places, I should just mention, this is interesting. Usually we think that majority are like kind of the media hogs. The majority, either religion, majority ethnicity, majority tribe, majority clan or culture of whatever group. Usually we think of the majority groups as kind of being the ones who are, discriminate or prejudice towards the smaller minority groups. That's not always true. There are some areas where it's an elite minority that control the majority. But this is in the idea that the media is hopefully, if it's an area where the minority groups don't have a strong voice, which often they do not, that they're giving, the news is being fair and giving stuff from their point of view, right? Water sanitation, week 17. Here we go, 50% recorded waterborne disease rate that we want to go ahead and that should be a decrease rate, or in individual families, a 20% decrease in vomit, diarrhea, illnesses of everybody in their household. In some rural areas, we actually have families keep track of their own local illnesses their children get. For that example, some of the mountain regions of Colombia I've worked, the best way we could keep track, actually, because there was no organized public health system, was that our community organizer, you have Build a Town, would actually have they would get data from all the local families, like the 500 or 600 people, the families on those mountains, for keeping track of. Moms and dads are smart enough to keep track of when babies and children get sick with vomit and diarrhea. They just write it down. They just say like, oh, it happened twice in August. It happened once in July. They keep track and they give you those numbers to see that those numbers should be decreasing with the water sanitation stuff. Week 18, food and agriculture. Again, shout out social media, give positive recognition. Now, first 12 months, has there been a 10% increase in crop yield? That's a little bit of an overkill measure, but the idea is, are you working towards an increase in crop yield? Some of these things, just so you know, I know we're 12 weeks out, but a lot of these things you're going to continue measuring over 6 to 12 months. I should just be clear on that. You need to make sure that there was the United Farmers Alliance created. In a lot of areas, farmers don't have a good voice. They play a crucial role. They grow food so your own local people can survive, but they don't get a lot of respect or have a lot of voice in government or public policy. Are they using rotational grazing? That's an important thing to save on crop fields. So all these like things that you're checking on. What else? Week 19, engineering. Again, shout outs, positive social media posts, recognition. That one we are working on. The engineering one is because engineers, just so you know, are so complex and there's like 20 different types of engineers. That one we will update it. This is a good time to mention, guys, to all my Build a Town organizers doing amazing work in the world. We are always updating this every couple months. What we put together is an insane protocol that's applied across multiple cultures and parts of the world and regions. It's so much to do. And you can't make a cookie cutter approach, but what you can do is find some best overall practices that trend well across different areas. And that's what we've done, and we keep working hard to do. So that's it, guys. For all my community organizers, my Build a Town organizers, I'll leave this PowerPoint up for you, so you can click on it and go through it yourself. And I'll also, obviously, you have this recording, this little PowerPoint recording. So good job. You can always email us at opensources123@gmail.com. We get 1 million emails every week. Just make sure you say who you are, what your country is, what your state or in your local town, city is, your town, village, or city area is. Okay? Keep doing God's work, guys. Don't give up. And we will see you next time. Bye for now.